She's excellent.
Good afternoon. Today gives me great pleasure to introduce Gabriela Nicolau. Gabriela, please, can you explain a little bit about your work?
Yes, hello, Jonathan. Thank you to invite me to this conference. And you just comment my name. I am nutritionist, and I work after many years with in obesity file in adult, but also in children. And I work in a hospital in the endocrinologist area, and this is a very important health problem because the prevalence of this disease is increasing every year. Not only here in Mallorca, in Balearic Island, if not in all the world. In the past, yes.
No, and what exactly does your work entail in the hospital?
Okay, the aim of my work in the hospital is to assist or to try to help people with morbid obesity, which is morbid obesity is something, is a name to characterize people with more fat tissue that the normal body have to have, and basically there are people that suffer from overweight, but also they have a lot of fat in the body that produce additional comorbidities like hypertension or a high level of uremic acid or high cholesterol. I mean, it's not directly, but could be. And in relation with overweight, we have different type of overweight. And in the hospital, basically people that arrive there suffer from a very high level of overweight. So my work is, we are a team with we are nutritionists. We also work face to face with the endocrinologist team, and we try to give to help people with this problem. So from my part, first I try to know exactly, or more or less, the cause of the problem, because overweight is not doesn't mean that the people eat a lot. The cause are the factors that produce overweight are multifactorial. So it's not the question is not only as nutritionists. I can't put a diet, give a paper to the patient and say, you have to do it, because when a person get to the hospital, need more help. So first is here, my work is here, the patient, then try to determine the cause of this problem, and also see if I can help them, because normally the doctor just assist them. Sometimes they need pharmacotherapy, or they need other treatments. Psychologist treatment are also very helpful for them. So I need to determine if it is possible change the habit, the behavior of this person, to help them to decrease the excess of body fat, or to maintain but increase the health performance. I mean, it's sometimes a patient say, I am not prepared to change my behavior, my nutritional behavior, but I will try to make some little change in the physical activity, or to not to eat between hours, you know, because when you go inside the behavior of the patient, sometimes you see that it's not, for example, a person can have breakfast, lunchtime, a little something in the afternoon in the tea time, and something to dinner. But it could be nice, it could be well, but after dinner, the problems start. So before go to bed, or sometimes they walk when they wake up in the night. So the problem is not during the day, it's just in the night. So first of all, it's very important to do a good questionnaire to know exactly which is the problem. And then after that, if the patient is prepared to change, it's necessary I can suggest some change, or in the behavior or in the diet. For example, try to do a more healthy diet, but no very low in calories, because probably it doesn't work. But a healthy diet, the concept of healthy diet, yes, this is not very difficult for a person. And also, in some patients, it's more easy to work with physical activity.
Yeah.
For example, what about, are you prepared, or what do you think of increase your physical activity, 10, 20, or 30 minutes a day, only walking, just a little walk, or go 200 meters and back, because the physical activity depend of the weight. Sometimes if I am 150 kilograms, I can move, because I can breathe, I can. So,
Gabriela, I have known your work for many years, and I know how dedicated you are. And I have a last question for you, even though
yes,
you and I could talk about this for a long time, because it's a very,
yes,
very critical theme topic.
yes, yes.
Is trust, the trust you build with your patients, important? Because you are very close to your patients, I think. The trust
Yes.
the patients have in you, how important is this?
Well, this is very important, because if you, if the, I mean, if the, you, how to say, if the patient trusts you, probably they are more open to listen to you and to follow all the recommendations, because they used to listen to different messages. You don't have to eat fruit after dinner, because that increase your level fat in the body, or you can drink water within the meals, because this is not true. No scientific research, no many topics without a scientific research.
Without evidence, without scientific evidence.
No. So I think for me is the more important is to try to walk work very close to the patient.
I think those last words are very, very important and epitomize your work, to work very close with the patient. Gabriela, thank you so much. I know you've had a very, very busy day, so I thank you so much for this very important interview. Thank you.
Okay, thank you, Jonathan, and thank you to share this very good space to listen to us anyway.